Hello everyone, I am Dr. Jayendra Yadav. I am a consultant neurologist at Medicover Hospitals, Mumbai. Today I am going to talk about a disease called neuropathy. So neuropathy is a broad term which means diseases of the nerves. There can be either damage or dysfunction of the nerves. Okay, so neuropathy presents with various types of symptoms. The most common symptoms would be tingling, numbness, difficulty in walking, losing balance, unsteadiness. Sometimes a patient may get symptoms like difficulty in judging where the ground is. Some patients can also develop weakness, so they have difficulty in gripping things or gripping chappals while walking. So the neuropathy is that a very common neurological conditions. There are various causes of neuropathy, but the most common cause which you find is diabetes. So India has such a huge population, and diabetes is so common in India. Okay, and diabetes over long term, it will lead to a microvascular complication, and the nerves are the ones which get commonly affected by this microvascular involvement of diabetes. Okay, so what happens is that because of the diabetes, the small vessels which supply blood supply to the blood nerves gets damaged, and that's why the nerves of the hands and the legs become weak. They get damaged, and then the patient will develop symptoms related to the neuropathy. Okay, sometimes these symptoms, this burning, pain, weakness, unsteadiness can be very severe, and it can incapacitate patient in his daily life. So diabetes is not the only cause for neuropathy. There are many other causes. The other most common causes would be nutritional deficiencies. Vitamin B12 deficiency is one very common cause for neuropathic diseases. Certain addictions, like commonly alcohol, can affect nerves and can lead to the very painful neuropathic symptoms. Sometimes taking certain drugs, the cancer drugs, sometimes some TB drugs which are given in resistant tuberculosis can also affect the nerves. So when it comes to the diagnosis of the neuropathy and neuropathic diseases, it is very important to see how the disease has started. So some neuropathies come very acutely means over a few days, like 3-4 days or a week. Sometimes they come over a period of like 1 to 2 weeks or 4 weeks, and sometimes the nerves disorder starts remotely. It may take few months also. Okay, so accordingly we can call it as an acute neuropathic disease, subacute or chronic neuropathic diseases. So, acute neuropathies usually are caused by diseases like immune dysfunction diseases. Okay, like GB syndrome, if you have heard of. In these, there is swelling and the nerves. So the nerves have got a insulating material called myelin. In GB syndrome, this myelin gets destroyed and the nerves dysfunction starts acutely, and then patient will present with acutely with symptoms of weakness, numbness, sensory loss, imbalance. Sometimes this nerve weakness can also affect the breathing muscles, and patient can develop breathing difficulty and can go on to ventilator. And this GB syndrome, that is acute neuropathy, is quite treatable. There are two treatment approaches: immunoglobulin and plasma exchange can effectively be used in treating this GB syndrome. Sometimes these neuropathies can come subacutely and chronic neuropathies. Okay, some neuropathies are effectively diagnosed on bedside examination. When we look at patients' strength, their sensory examination, the reflexes, all those can be helpful in diagnosis whether the person has a neuropathy or not. The best investigation to confirm whether a person has a neuropathic disease or not is doing a nerve conduction studies. Okay, and then we can, once the neuropathy presence is confirmed by physical examination and nerve conduction studies, we can take help of certain laboratory investigations to confirm what is the cause of neuropathy. So commonly, if person present with neuropathy and it is like subacute onset or chronic onset, the first investigation which any neurologist like to see is the sugar control. Okay, so treatment depends upon what is the cause. So if a person is having neuropathic symptom and it turns out to be diabetes, we have to treat diabetes effectively, and symptomatic treatment for the tingling, numbness of these neuropathic symptoms. If it is like nutritional deficiencies, we have to treat nutritional deficiencies. If the neuropathy is because of the alcohol consumption, we need to stop alcohol. Sometimes neuropathies, as I said, maybe because of the drugs, then we sometimes some cancer patients are given some chemotherapies. Those chemotherapies can affect nerves, and then if the patient's symptoms are really bad, then at times we have to change these drugs also. Okay, so this is in short regarding neuropathy and neuropathic diseases, their causes, their symptoms. If there is any query, you can get in touch with us. I'm Dr. Jayendra Yadav. I'm available at Medicover Hospitals.